What's wrong with this picture? This is my cousin's toothbrush. His toothbrush for his teeth. He wasn't using it to clean his shoes or smooth the grouting. This is his actual toothbrush. Your toothbrush is supposed to be one of your most beloved or sacred possessions. It's not supposed to look like it needs to go for abuse counseling. We're lucky enough to have a wide range of toothbrushes to choose from, and using the right type of toothbrush can help you address your oral hygiene needs. This next segment is dedicated to my cousin's toothbrush, who tragically gave his life for the cause. I promised myself I wouldn't cry.
This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
As a mother, you want the best for your family. For healthy gums, strong teeth and fresh breath, switch to Aquafresh All-in-One Protection. Aquafresh does it all in one, Mum.
I'm in Cape Town with periodontist Dr. Howard Gluckman to broaden my knowledge on toothbrushes, which ones to acquire, how to use them and when to use them. Dr. Gluckman, can I go without brushing my teeth, and when is a good time to start?
Two outstanding questions, and the first one, without definitively, you cannot not brush your teeth. There's no debate about that, and you should be brushing your teeth twice a day. The second question, also a great question, which a lot of people ask us, when do you start brushing? And the answer is as soon as a child is able to pick up a toothbrush. And I think as soon as the child allows you to get into the mouth with a brush, start brushing the teeth, because the plaque starts almost from the word go.
Brushing seems like something so straightforward, but how do I make sure I get the basics right?
What we found in our practice, it's very important that you start kind of in the same place and you end in the same place. You know, a lot of patients, they start in the front and they go to the back and they go here and then they go there, and what they end up doing is they end up missing up a whole lot of teeth. A common mistake that patients make is they'll start here and they'll start brushing, and then they'll turn. And as they turn, they kind of miss out a whole section of the teeth here. So something that patients or people should look at is that when they're brushing, brush, turn and go back, just to make sure that you go over the areas that you've turned from, okay? The second thing is that there are a lot of different techniques. We prefer like a little bit of a circular motion, okay? The action of scrubbing your teeth, that's the kind of motion that's going to do a lot of destruction to the teeth. It causes a massive amount of destruction. That's where we start getting into gum recession. That's when we start getting into abrasion of the tooth, and that's when sensitivity starts. It's very important to use gentle pressure on plaque. One of the things that people often miss with plaque is that plaque is very soft.
Should I change my toothbrush regularly?
Often you'll hear people say, yes, around 3 months is when you replace your toothbrush, and 3 months is pretty much a good standard. The bristles need to be in a specific position so they kind of get into all the nooks and crannies, because your teeth are not a flat line. But if you are somebody that does brush hard and you do notice that the bristles are starting to splay, get rid of it. Even if it's in a month, get rid of it and get a new brush.
Will worn out bristle ends cause damage to gums and teeth?
There's no debate they can. What we're looking for in a good toothbrush is you've got to have the little bristles must be well polished. And when they're well polished, it means they're nice and smooth and they're not going to act like a sandpaper. You don't want to keep using it for a year. Even if you've got fantastic bristles, they are wearing down, even though you might not be able to see them.
What about bacteria buildup on the brush head?
Bacteria buildup on the brush head is not a major thing. You know, there's no debate. The mouth is teeming with bacteria. There's about 500 or 600 different species of bacteria in the mouth alone. That's despite the count. It's very important that after you've brushed that you rinse your brush well. And I often see, you know, when even my own kids, you know, when I take out the toothbrush, you can still see there's half the toothpaste left on it. And it's important that you run it under warm or hot water so that you make sure that you clean all the stuff off. What you can do as well is there's chlorhexidine-based mouthwashes which you can get, and it's very good to sometimes or every now and again just dip it in the chlorhexidine mouthwash, let it sit in there overnight perhaps, just so that it helps to kill the bacteria that are on the toothbrush.
Why should I brush my teeth for 2 minutes twice a day like most dentists recommend?
The 2 minutes twice a day is a bit of a misconception. I think what we're wanting for is the 2-minute minimum. I always tell my patients you need to brush your teeth for as long as it takes to get your mouth clean. And I think, you know, some people might have 1 or 2 teeth and other people have all 32 teeth, and if whichever one you have, and if you have teeth that are a little bit skew, where you've got a little more nooks and crannies, it takes a little bit more time.
Does the fluoride continue to work after you've done brushing?
Fluoride is a phenomenal material which actually strengthens the teeth. So in areas where you have tooth decay, that fluoride will actually act to try and reverse some of the tooth decay by strengthening the crystals that that form up the tooth structure. And the other thing that fluoride does is fluoride also has a natural antibacterial effect. So it'll also help to kill off bacteria in your mouth. So yes, it will carry on working for a short time after you've spat out.
Thank you, Dr. Gluckman. I'm sure we will all benefit from your knowledge and wisdom, even those of us who only have 2 teeth. If any of our viewers have any further queries or concerns on this topic, we suggest you contact your medical practitioner.
As a mother, you want the best for your family. For healthy gums, strong teeth and fresh breath, switch to Aquafresh All-in-One Protection. Aquafresh does it all in one, Mum.